Thank you for coming to this presentation. My name is Massoud Alibakhsh. I'm the President and CEO of Nuesoft Technologies. By way of disclosure, I'm very opinionated, but my opinions, contrary to Dr. Shubin, represent everything that my company stands for. Today's talk is about going mobile. There's been a couple of interesting talks, one namely by Dr. Shubin that covered some of the apps about mobile technology and e-health. My talk is going to be more focused on trends and the evolution of technology as it relates to mobile technology and healthcare. If you proceed to the next slide, the title of this talk is Disruptive Technologies. By way of definition, disruptive technologies are technologies that displace an existing technology by introducing a new innovation. And some of the attributes or important attributes of disruptive technologies is that they offer greater efficiencies, and ultimately they lower cost and they remove barriers that exist for scaling or wholesale adoption of new tools or products. They also radically transform markets, or they can create new markets. If you go to the next slide, some of the good examples of disruptive technologies in recent times, railroad is a good one, and the turn of the 19th century, the emergence of railroad and the train technology completely transformed local markets and changed the whole equation between the consumers and producers by shortening that distance and creating a lot of efficiencies. Towns that were on the way that happened to be where these railroads went through became cities, and the growth expanded tremendously. One recent example of a disruptive technology is the internet. You can all imagine what the internet has already done today, but if you go back in the early 90s, some of the companies that emerged in those days, one of the first ones was Amazon, that popped up by just selling books. Today you have numerous companies that have essentially dominated our markets, namely Google and eBay and Amazon, and they've introduced new products and new ways of doing things, and they have disrupted existing markets similar to what the railroads did. Now, in the next slide, we're talking about mHealth. mHealth, as it's defined, is the practice of medicine supported by mobile devices in general terms. It comprises a number of technologies in the modern era, including laptop computers, patient monitoring devices, telecommunication tools, and smartphones. And smart mobile devices that is really the subject of this talk. If you proceed to the next slide, you can see how smart devices, mobile devices, are bringing about the demise of some not ancient technologies, namely desktop computers. And this graph actually shows the growth of smartphones in terms of shipment versus PCs within the last 2 years. As you can see that by 2012, it's going to exceed the shipment of PCs. And now that trend actually speaks volumes in terms of the new device, mobile devices, disrupting the old computing model as it relates to desktops. In the next slide, you can see smartphone usage rates. I think everybody's quite familiar with smartphones, the recent stats are that even despite recession over the last few years, the growth and adoption of smartphones by general public has been accelerating. And that includes the physicians. A recent survey actually indicated that the usage of iPhones by physicians is a higher percentage as opposed to general public. But this graph actually indicates how fast the smartphones are being adopted, and that adoption is accelerating. Now, the next slide, we're focused on why are the physicians interested in mobile devices today? Well, the adaptability of smartphones to physicians' workflow could be probably the primary factor. The mobility of these devices and the fact that they provide a different ease of use and the comfort level of physicians with these devices, similar to general consumers, as they use these devices to make phone calls or download simple apps for personal reasons. And in particular, physicians, there are a number of apps that actually in Dr. Schumann's presentation refer to that are focused specifically to aid physicians in the way they provide care. Reference lookups for medications or drugs or dosage calculators, as well as publications that are available. The fact that these devices are mobile and they have connectivity make them ideal for providing these functions. And the physicians, like other consumers, make those choices, and it's easy for them to adopt these apps and these tools in their daily operation. So it's not as disruptive as the traditional EHRs that were anchored to a desktop using some sort of template-driven model that would force a physician to leave his normal process or workflow and go sit at a desk to try to document or look up some information. So the other factor is also the patient expectation and their engagement. There are a number of applications that can be named for disease management or correspondence, or also PHR, personal health records. A recent survey indicated that about 50% of the population are interested in personal health records, although only 3% of folks have actually attempted to go online and fill one. Now, that we think is going to radically change as these mobile devices begin to provide some of the healthcare-related functionality. In the next slide, we focus on why now. Mobile devices have been around for quite a number of years. In smart mobile devices have been around, and the Palm is a good example. But the acceleration today is due to a few factors. Number one, the size is smaller and the device is lighter. The battery life has increased tremendously. The display quality is improved radically. And the expanding of wireless networks make the data availability and connectivity to the cloud and other computational devices through these mobile units a possibility. And last but not least, more powerful operating systems. These smarter devices not only are becoming faster with faster processors and more capabilities of memory, but intelligent and more sophisticated operating systems prepare the path for new apps and much more powerful apps that were possible before. And the fact that these new apps are riding on these mobile devices not only use the capabilities of the mobile device, but through that connectivity, they can, through the network, connect and exchange information through the cloud, or even use the intelligence and the capabilities of other devices that are connected to the mobile device as a gateway. And that's going to be a game changer, essentially. And I'll note why in conclusion. In the next slide, if you look at the survey has been done, that the physicians' functionality preferences, at the top is medical image viewing, almost 50%, and next to that is patient records, followed by email and notes and memos, and e-prescribing is a big one as well. Clinical decision support, lab orders and results, and some of those functions are really components of what is known today as the meaningful use, or the pieces of an EHR. So it's no surprise that the physicians have indicated their preference for those functions. In the following slide, the adoption of EHRs and smartphones, the two graphs are interesting if you compare. EHRs have been around for quite a number of years, and there have been many companies producing different versions of this animal. And it's changed its acronym a few times from EMR to EHR, but essentially it's about compiling patient information and allowing the physician in automated fashion to record the visit about the patient, also be able to prescribe medication and order labs or view lab results. These systems haven't traditionally been successful in really getting an adoption rate. Although that's going to radically change, and we feel that part of the reason that they haven't really been successful is because they haven't been compatible with the physician workflow, and because they've been anchored to the desktop, that by itself limits the productivity of physicians. Whether that's perceived or real, that's how the market has responded. So these systems have had difficulty in getting penetration in terms of true adoption. We feel that the smart mobile devices will change that, and for many factors. And if you look at this graph, the adoption rate of the EHRs actually improving, and they somehow correlate with the growth of smartphones. Now, barriers to EHR adoption has been usually cost, time investment, training technical reasons, because they've been quite complex, these applications. And as I mentioned, they've been tied to the desktop that really affects the normal workflow of a physician, a traditional workflow. And they haven't really demonstrated any improved productivity. Even some of the systems that are deployed today, the workflow implications are most current systems designed for older platforms. Most of the systems that are available on the market today have been designed over the last 10 years. They don't match the process flow of doctors, namely, as I mentioned again, it's because of lack of mobility and connectivity. They have a tendency to disrupt the clinical encounter. And imagine if a physician sits behind a desktop and he's not even looking at you and trying to diagnose your issues. I think most physicians already intuitively understand that why these traditional EHR systems have not been helpful. Now, in the last final slide, the evolution of HIT, the first one is a desktop-based model, and then there's a laptop that actually connotes some mobility, and finally smartphones. Now, I think I'll save the best for last. We believe that it's not only the evolution of the technology itself as it relates to the hardware and connectivity that's going to change the game, and it's going to create that disruptive technology. but it's the worldview of the application designers. Now, when an engineer, an application designer sat and viewed a desktop model, the worldview is really a small office and a few people interacting with each other. And that's what the world of a designer was, and they created those systems for that world. Now, with the advent of the internet and the connectivity, that somewhat started changing. The laptop in the middle indicates that transition, that some mobility was introduced to the world of computing. So a new application designer that can consider his user can move about and is not only connected to a few folks in the office, but potentially to other folks or other areas, the way you look at designing an application completely changes. Now, because you're dealing with a variety of users, and you can't design something that has focused training, you're actually obliged, if you're going to have a successful application, to make this as user-friendly as possible. So new ideas come about because the device is different. New ways of interacting with the device take shape, which we collectively refer to them as user-friendliness. Now, you can imagine the last one as a mobile device, what the designer of that application who's going to develop one for a smartphone, an iPhone, or a Droid-based device, what their thinking is. The last presentation was appropriately named. There's an app for that. The name, the terminology, app itself is a new term, as opposed to an application, which composed many different modules and with a lot of complex functionality. Whereas these devices focus on one function or a couple of simple functions that are deliverable, they're quick, they're easy to consume, and they're understandable. And they also use the new capabilities of these devices to make connection with that user and help reach the gap, as opposed to forcing the users to come and adopt and adapt to the device. The device is now capable to try to adapt to human forms of interfaces. I mean, the Google Voice is a very good example. And the whole gesture recognition is another example. Collectively, these features are going to create a new world, and we feel that applications that are designed and developed on a native environment, specifically for these mobile devices, not the ones that have been transported to extend their lives, but those apps are the ones that are going to disrupt the entire market. And in that regard, we don't think that any of the existing EHR systems that are deployed today will be around or within the next 3 to 5 years if they do not extend their functionality to a mobile platform. And they will be considered archaic and dinosaurs. Thank you.